Hi, I'm Dr. Jill, and you're in for a little discussion on circumcision and why I am super not into it and why a lot of people disagree. Circumcision has been one of my areas of fascination since I was a wee lass. Before I was even a sexologist, I just thought it was what is up with that? So let's talk about what is up with that. Circumcision is a procedure in which the foreskin of the penis is cut off. Sometimes it's in a surgical way, although historically that has not always been the case. The foreskin does have a function. So a lot of people who've had their foreskins removed when they were born just think they don't notice anything different because they have nothing to compare it to, and we don't necessarily realize what we're missing, right? But foreskin does have a number of functions. This is Winston, he's gonna help us out. So it protects the glands or the head of the penis, and it creates a nice glide. It's kind of like your eyelid over your eyeball, right? So that if you, like, the world is not touching your eyeballs, but if you have an itch or you need to, right, you can like move the eyelid over the eyeball. So that's the idea here, is that there's skin protecting this, and so that the head or the glands of the penis is not what's necessarily always touching underwear and pants and other people's body parts during sex acts. It has a glider that's kind of rubbing and keeps it moist, it keeps it protected, and it keeps it not desensitized over a lifetime of rubbing on materials, right? So it keeps all the nerves extra sensitive as life goes on. It also has sexual functions. It is biologically equivalent to the clitoral hood. Going back to what we know about genital homology, or this idea that the genitals don't always, but can and often kind of grow in different directions. So the ovary, for instance, is the same as the testicle insofar as the embryonic tissue that were used to develop them, and very similar in their function of producing sex cells and producing sex hormones. Similarly, the clitoral hood is the same embryonic tissue and grows from the same as the foreskin. So imagine cutting off the clitoral hood. It would expose the clit to it would be like, all the time, right? Now, why do people do this? Why would one cut off a part of the body that has functions? One might ask, well, let's dive into that. What's that about? There is a religious tradition around this, especially in Jewish and Muslim tradition in particular, in which circumcision of the penis is the norm. But American culture is very different in the way that it looks at circumcision, and it is a fucked up story, okay? So I just want to put that out there. In 19th century America, there's a lot of anti-masturbation sentiment. It's considered self-abuse, and there's a lot of myths that pop up around all the bad things that can happen to you if you masturbate. You'll go blind, and you'll grow hair on your palms, and all of these silly and ridiculous things. Literal insanity. They thought that you would become mentally insane. So there was just a lot of myths because culturally there was an issue with masturbation. So you have a cultural phenomenon and a norm impacting a belief around biology. And so there were some folks going on at this time period who were real crusaders against masturbation. Some of these people you may know, or you may know of them and may not know that you know them. So there was a man named Dr. Kellogg, and he believed that masturbation was terrible and that there was a lot of ways to curb masturbation in young children, who, if you've ever been or have young children, know are often very curious and putting their hands down their pants, and this is a normal child development. But they didn't like this at the time, so what was going on was they were prescribing different strategies for eliminating. One of them was bland food. The idea that having a boring diet was going to make one uninterested in masturbating, and this is where we know of Dr. Kellogg and his Kellogg cornflakes. Graham and his graham crackers was another pioneer at this time against masturbation. There was also calls for carbolic acid by Dr. Kellogg to put on the clitorises of infants, as well as removing the foreskin of infant male children. And this was what they did explicitly because they didn't want them to masturbate. As we progress culturally out of this anti-masturbation crusade, at this time now, circumcision is a cultural norm. And what we do is we apply a different set of standards or rationale, if you will, to it. So it used to be, we don't want the children to masturbate, so we're going to remove the foreskin. And now a couple decades go on and people have been getting circumcised as infants, and this is just now normal and cultural, and we do this thing and we've forgotten why we do this thing. And so it gets a new rationale, which is health and hygiene. Whereas health and hygiene was never the reason to begin with. And that's because the health and hygiene argument is not super compelling when you really break it down. Does the foreskin collect bacteria, oils, skin cells, and other things that can collect? Sure, but so does labia, and so does clit hoods, and so do other areas of the body that we just clean, and we teach young children how to care for. Think about if you get earwax, right? You clean it out. It's not that big of a deal. We cut off labia and clitoral hoods. The word that we often use for this in the United States and in other areas of the West is genital mutilation. But when it's done to penises, we have all these other rationales for it. But this hygiene messaging is just in our brains. We just think penises are going to be so dirty and disgusting if we don't remove this skin. And it's just not really true. Another common myth that you hear in the United States about why we should be circumcising infant boys is that it's going to reduce the risk of HIV. And kind of, but not really. It's an example of taking a study that was done on a specific population with the needs specific to that population and overgeneralizing it to everyone in a way that doesn't fit. So in sub-Saharan Africa, or other areas with high amounts of HIV infection, then the World Health Organization does say that it can be used as a reduction strategy in conjunction with other measures, including condom use and sex education. But we in the United States still have a lot of issues with talking to young people about sex education and condoms and just general sexuality. And so we're thinking that this is going to, just this one thing is going to solve it. It's really not. It's a specific measure to that population, because when it's an epidemic crisis, then you take measures that any little bit can help. But in the United States, where we do not have those levels of HIV infections in most populations in the United States, and we are just blanketing without the conjunction of the sex education and condoms, promoting infant circumcision as a method is not as helpful. At this point, it becomes an ethical question of is a teeny tiny, if any, amount of reduction in the United States of infant circumcision is actually going to show any notable difference worth the ethical issues that are brought up when you take a part of the human body, specifically a very intimate and sexualized part of the human body, in a less than 24-hour-old human and make irreparable cosmetic changes to their body in a surgery that is not medically necessary. It becomes questionable. Another common reason I've heard about why circumcision is a good thing is that it's more aesthetically pleasing, and we're going to unpack this one. This is kind of a bizarre, right, if you think about it. So the idea is that foreskin is ugly, and I just have a problem with this. I think this idea is rooted in two main issues. One is general sex phobia, general body negativity, and our cultural stuff around genitals being gross and ugly and dirty and all of these things that is cultural conditioning. It's a body part. It's like every other body part. It's like a nostril and a thumbnail, and it has its job and it has its function, and it is what it is. And we've put a value on it, and we've decided it is this and it means that it really just doesn't. And so there's this altering of the body that's happening because of our own judgments. And if you think about any other part of the human body that you did this to an infant to, we think would be pretty fucked up. So say if we culturally got together and we think chins are ugly, or pinkies are ugly, or eyebrows are ugly, and we took a day-old infant and just cut it off because we think it's ugly. And the debate doesn't have to be, although I don't think that foreskin is ugly, the debate doesn't matter if it is or if it isn't. Say it's ugly. Say it's the ugliest thing in the world. If it was anything else, and we say, I think fingertips are ugly, and I'm just going to cut my babies off, people will be like, you fucking monster. What the hell is wrong with you? This is a perfectly healthy infant. Like, what is wrong with you, right? But because it's around sex and penises, and like we have all these values and judgments, it becomes like normalized. So issue one is like, check your own stuff around why do you think that foreskins are ugly and therefore deserve to be removed. And the second is we're used to it, right? I say this about earlobes. If you look at the external ear, right? Look at my external ear. That is a sight to behold. We have all these floppy things sticking out the side of my skull, and they twirl, and they have all these orifices and little crevices. And imagine everybody you've ever seen had them removed at infancy. So it was like this, seal type of face where it just goes right back, smooth down the side of your face. And everybody you always saw had that. And that's what you're used to seeing all your life. And then you met somebody who has all this weird, floppy, curly Q skin hanging off the side of their head, and you'd be like, that's weird. That's ugly. But because you see ears all the time, you don't even think about ears. And I think it's the same thing with foreskin. If you're in a relationship with people over your life who've not had foreskins, and in porn they often don't have foreskins, and even Winston doesn't have a foreskin, and you're just used to not seeing foreskins, and this is now normal. If you see that piece of flesh hanging off the end of a penis, I can understand how it might be like, oh. But you've been seeing things that have been, one could argue, mutilated your whole life, and now you're seeing the normal thing, right? So it's a perception issue. Either way, whether we're thinking it's ugly or we're thinking it just is out of place because we're not used to seeing it, it comes down to being introspective about our judgments on this and how it's impacting decisions about other people's bodies if we're talking about our children who have penises. When it comes to our partner's penises and how we are viewing those aesthetically, I think is, as always, my messaging around it, any type of sex thing is be kind, right? Treat how you want to be treated. There are some medical issues that a foreskin can cause some problems, some pain. It's too tight, so as the penis grows throughout development, the skin isn't stretched. Sure, there are some medical issues, and this is a rebuttal I get a lot when I talk about how circumcision, that's not medically necessary, does cause, I would argue, some more harm than good, at least in the United States, and is inherently shame and sex phobia based, is that they'll bring up phimosis, they'll bring up some other medical issues, and to which I say, and I'll say to you, that's beyond the purview of this conversation, because I'm not talking about having a medical need and not treating it. Of course, if there's a problem, then fix it. I'm talking about routine, right? So that's the key word here. Routine circumcision, meaning baby's born, it has a penis, circumcision. Boom, boom, boom. A few years ago when my sister had a baby, I was her birth coach and was in the hospital with her during the delivery, and one of the discharge papers, a checklist of things that she had to have done before she was allowed to leave the hospital with the baby, included a circumcision. It didn't say optional, and she had told the nurses and the doctors and everybody a million times that she was choosing to not circumcise this child, and still it was every pediatrician, every nurse, everybody who came into the room, it's like almost like they weren't talking to each other, said, we need to schedule that circumcision. And she had to be like, no. So they weren't pressuring her or trying to change her mind, but it was that this is the norm, this is the expected, it wasn't discussed, it wasn't, this is an elective surgery, and it was still considered like, we're just going to do this as the normal thing, and you have to opt out and keep advocating for yourself throughout the whole entire opt-out process. becoming less and less so the case. Starting in 1982, California was the first state to eliminate Medicaid coverage for routine circumcision. So again, not if there's a medical necessity, but just doing it. And currently, as of 2011, as the last data I have seen, there are 18 US states. So it's becoming less common. At the height of the popularity of circumcision in the United States was in 1981, where we had almost 70% routine circumcisions, and now I think we are down into the 30-something%. So if a penis-bearing individual is born today, more likely than not, they are not going to be circumcised. So it's going to be a very different experience growing up than those of us born before the year 2000 had experience growing up. So we talked about it. It started as a sex-phobic, anti-masturbation, very extreme anti-masturbation rationale, moved into a health and hygiene rationale, and now the number one reason cited when folks choose to routine circumcise their children right after birth is because the father of the child is circumcised. So now it becomes this generational tradition where we know that the masturbation argument is bullshit, and we also don't care. And we now know that the health and hygiene issue is irrelevant. We're now saying, well, I don't want this boy to look different than his father. And I try to be sensitive and open-minded about people's different experiences, but I gotta tell you, I just can't wrap my mind around this one. I just don't get it. I just don't understand the appeal of continuing something that we know is not only not helpful, but can be harmful, which I'll talk about the harm in a second. And because you want this child who, I mean, how often is this child going to be seeing their father's penis, and what does it mean that they look different? Can that be explained in ways? This is a good teachable moment in a family to talk about why they do look different and what foreskin is and how our views on sexuality and bodies change throughout time, and why you decided not to do this for your child, but why daddy's parents did decide to do that back in the 90s, 80s, 70s, whenever you were born, right? So good teachable moment. So I think I challenge that perspective. I do challenge that perspective. So let's talk about the harm. What is the harm? There is a 6% chance of minor complications and a 1 to 3% chance of major complications, including bleeding out, hemorrhaging, and death. There are infants that die every year from botched circumcisions. Many people argue that there is also a reduction in sexual pleasure. This comes from anecdotal research, I guess qualitative research, on folks who, for whatever reason, whether medically or aesthetically, decide to get circumcised later in life. So they had the experience of having a foreskin, and then they have the experience after. And they often talk about the feeling of less than, that it's certainly muted sensation, and also that the way that they engage in thrusting behavior to have an orgasm feels like, I've heard the expression used, a broomstick handle, that it's very thrusty versus to overcompensate for the lack of sensation versus when the foreskin's on and it's kind of this gliding, right? That's more intuitive and more natural. So I've heard this be discussed as well. And then to the extreme, this is not, I would even argue, not even most people, but there are folks who've had the experience of circumcision as an infant or young child and say that this was very traumatic, that they viewed this as a sexual violation, that they viewed this as a rape, or some type of really violent, non-consensual experience against their body. And there was a lot of rage and a lot of anger. So ranging from people be like, I don't care, I've never thought about it, to this was extremely traumatic, to, okay, I wouldn't have chosen for myself, but it is what it is, to, I have some reduction in sensation, but like I'm not losing sleep over it, and all along the way. If you have a penis and you want to have it circumcised, all for it, no judgments. We all should have the right to do to our own body what we want to do. But I would caution against routine circumcision if you have a child who has a penis. you can always do it later if for aesthetic reasons or health reasons or hygiene reasons or whatever reasons that you and your family decide are best, you choose to do that. Because you can always do it later, but you can't undo it. So it's something that is worth just kind of waiting and seeing about. If you have a penis or have a child who has a penis and you're thinking, fuck, what did I do? I'm hearing this whole talk about circumcision. It never occurred to me. I never thought about it before. And hearing you talk about circumcision makes me feel like I made the wrong decision. Or what do I do? What do I do now? And I first wanted to say that I want to make space for that because I understand that none of us got good sex education, good, comprehensive, thorough, medically accurate sex education. And so, I mean, forgive yourself. Don't beat yourself up about it. You weren't told, right? So I think, don't freak out about it. It's okay. But I do think, depending on the relationship you have with your child and the age that you have with a child, I think it's worth acknowledging that that you have a second opinion about it and you've come to change your mind about it, and acknowledging that, or maybe even apologizing to the child if that feels appropriate. If you have a penis and it's been circumcised and now you're thinking, oh shit, what can I do? There are some not super necessarily successful, but maybe worth checking out options around regeneration. I think it includes graduated weights that are put on whatever little foreskin pieces tissue might be left, and putting little baby weights on them and getting bigger as time goes on until the skin can be regenerated. I don't know if skin grafting, I'm not sure. It might be something that's beyond my wheelhouse, but I think that there are some potential options. Not wanting to say like, oh, I can just get my foreskin back. It's not going to be simple. It's going to be something you want to be really dedicated to. You're going to have to find a physician that you believe in and trust can give you the most sex positive experience around this. But I think that it can be possible, at least for some people. So that might be something worth getting into. Well, this was our little talk on circumcision, so I hope that was fun and interesting and illuminating for you. I get asked questions a lot about circumcision, whether it is about whether to or not, or my opinions or my professional insight on it when one is pregnant. Also, I get a lot of questions about it from people who have a sexual partner who has a foreskin and they've never met a person or had sex with a person with a foreskin before, so they're not sure if they need to do anything different. You really don't, but as always, communicate, check in, ask if they prefer something different, but otherwise, just do your normal thing. And sometimes, but less commonly, folks who don't have foreskin, they're adults, and now they're like, I'm curious about what can be done. So hopefully those questions were answered for you, and if none of these questions are particularly relevant to your life right now or the foreseeable future, at least you found this interesting. It's always good to just put more sex knowledge into our brain. So hopefully, somehow, you found this valuable.